we're going to take you behind the scenes for a complete chest-to-head 2,500 graft procedure. Now this procedure, it's a very advanced and precise procedure. It's highly customized. There aren't a lot of clinics that actually offer this service. We are working as a very efficient team because we are actually grafting on both sides of the chest, pulling the grafts, and also placing the grafts into the head simultaneously using direct hair implantation. Are you ready? Let's begin. Jay has been gracious enough to talk and kind of give his story. I mean, it's an amazing story. You've had a lot of procedures.
There's no question this is the best transplants that I've had. There's very little recovery, no downtime, and he's been able to take hair from my beard, back of my head, and my chest and my abdomen, and I'm very, very happy with the results.
Compared to when you came, you know, you had some really large kind of plugs. That was kind of the old way of doing things. And we went through and kind of broke those up. And you had kind of a disconnection between the sides and back of your head with the top of your head, and we've really kind of connected it all. Really got this nice hairline.
Cosmetic results is wonderful, and I'm very, very happy, and got a lot of compliments from what's going on so far.
So today we're just going to keep on building up what we've done. We're going to go in through the existing hair and do a little bit of work on the back just to continue to connect the crown to the back of the head. So it should be a great day. So we're getting ready for the procedure, and it's going to be a quick procedure. Even though we're doing 2,500 grafts, we're going to be able to extract and place at the same time. So at North Atlanta Hair Restoration, we have multiple providers, myself, Dr. Matt Goldstein, and I have two very qualified physician's assistants. We'll be working as a team to literally take the grafts out and put them right back in the head. Now we are numbing him on both sides. The numbing procedure for the chest is not as easy as numbing the donor side of the head or even the recipient part of the head. But if done properly, it is very effective and minimally painful. Like with anything else, numbing, you can do it the right way or the wrong way. So what I like to do is just start with a few skin sticks and literally push the numbing down. And every time we numb, we go into the numb area first and push under the skin to numb, and that actually doesn't really hurt. Unfortunately, with the chest, it is impossible to do a nerve block and block the areas that we were extracting from. And so we have to numb every portion that we're extracting in that area so that the procedure is pain-free. To make this a safe procedure, we use lidocaine and a little bit of epinephrine to help kind of bind the lidocaine to the nerves, but we dilute it in 250 cc's of normal saline. So this is called tumescent anesthesia. And what that allows us to do is to be able to safely numb a huge area without getting into toxic levels. We are going to be creating new types of content for this channel. If you like this type of raw, behind-the-scenes videos, please like and comment on it so we know it's something you want to see more of. Let us know of any other topics you'd be interested in us making as we move forward. So here's our zone of extraction right here. Previous procedures we actually took from the midline, also in the chest. You can see how you can take a massive amount of hair from the chest especially, and it still kind of grows back. But we're being a little bit more selective on this side. They're kind of darker, kind of thicker hairs, and I think it's going to work great. The nerve blocks that we use create an incredible amount of anesthetic coverage with just a very small amount of medication. And because we're only injecting 1 cc at each site, and there are 4 sites, 2 above each eye, just above the eyebrow, the procedure is very fast. One of the best ways to numb the top of the head is to actually do nerve blocks. So there are 2 nerves that exit right above the eyebrow, and that's called the supratrochlear nerve and the supraorbital nerve. So we do 4 small injections above. It's only a cc that literally will block almost to about right here, this whole territory. And with a little bit of medicine, you can get a huge area of coverage. Interestingly enough, these are the same locations for when you do Botox. The Botox is just injected a lot more superficial, but these are really power-packed, very efficient way of getting somebody numb. Okay, now we're beginning the extraction phase. So you can see here that my physician's assistants, who are extremely talented in what they do, are extracting grafts using the Devois hair transplant wireless device. And these devices are amazing. We're able to use very small trumpeted punches, which creates a very small exit wound. And as we continue to harvest, you can see that the team is now developing more momentum and working simultaneously with extraction, pulling of the grafts that were cored, and then loaded in implanter pens for direct hair implantation. This is all done under loop magnification, and you can see that everybody has high definition loop magnification so that visualization is properly done. This is my medical assistant, Lan, who is extracting cord grafts, and she does this very efficiently using a double-handed technique with 2 forceps, which is really the safest thing for the grafts and the best way to pull. You can see that during the extraction there is not a lot of bleeding, which is very common when doing the chest and abdomen. The tumescent anesthesia creates a significant amount of bleeding control and makes the procedure very clean. We're actually almost done. It's a little after 10. We started at about 7:30 and we're doing 2,500 grafts, and we've already pulled 2,200 and placed probably about 600 to 700 already, so we're moving along. Mm-hmm. The direct hair implantation technique, I'm watching Dr. Goldstein place some, is the way we have placed grafts since 2013. I'm one of the first physicians to make this the mainstay of implantation. And the nice thing about pen implantation using DHI, we're able to go through the hair without shaving it, and we're able to place the grafts in between the existing hair at the same angle so that there's minimal damage to the existing hair, and we generally see minimal amounts of shedding.
All right, man, thanks a lot for getting me out of here.
Yeah, well, we'll just kind of do a quick handshake. We're all done. It's about 2:30 and he's heading to the airport right now. How was your day?
Went real good. We got it done quick.
Yeah.
No pain. Everything went fine.
Yeah, and you're working tomorrow, right?
Yes, sir.
Awesome. Well, you got to get to the airport.
All right, thanks a lot.
Appreciate you. Yeah, we'll talk soon.
All right, 6 months.
6 months, yep. You can see at the time of discharge, he is very clean and he's ready to actually get on a flight this afternoon to go back home in a very minimally noticeable manner. He's very excited. In fact, he plans to work tomorrow the entire day. One of the interesting things is that every patient has a story. This particular patient has been working with us over the span of a couple years, and I've been steadily and effectively giving him the look and confidence he's been wanting. We had a plan and we acted on it. He trusted us through multiple procedures to make it happen. And I couldn't do this without having a great team here at North Atlanta Hair Restoration. They made it all come true, and I'm super proud of the work that they do. We really care about our patients and making sure the experience is great and the outcomes are a success. Again, if you've got questions about what you saw or want to know more about the process, feel free to leave a comment below. We're happy to share what we know. Thank you.